Welcome to the Retreat Radio, where we go beyond temporary fixes and surface-level symptom management. Here, we dig into the real root causes behind your symptoms so that you can understand your body, advocate for your health, and ask the right questions. I'm Heather Witt, physician assistant and owner of the Retreat Wellness and Aesthetics. This podcast sits at the intersection of aesthetics, longevity, and functional medicine, and you'll get information without the sugarcoating, the trends, or the nonsense fluff. Let's get into it. Hello, everybody, and welcome back to the Retreat Radio. My name is Heather Witt, and I'm a physician assistant practicing here in Newport Beach, California. And today I have a really cool episode for you. I was recently a guest on Lexi U's podcast, and I have the video recording, so there will be video with this. And we were talking about sexual wellness. And this has recently really become a topic that I've become very passionate about because I think that it often gets missed when we are thinking about functional medicine or when we're thinking about hormone therapy. I think a lot of people just think, oh, it's not as important, like just give them like a scream cream or something like that and they'll be fine. But what a lot of people don't realize is that it is a multifaceted issue and there can be multiple reasons why there is something going wrong. And really finding out that root cause of the problem is going to give your patient the best results. And so that's exactly what we talked about on that episode. And so I'm really excited to share it with you today, to bring it to you. I just want to jump right in. But first, I want to give you a little introduction to Lexi and who she is and why she's so important. So Lexi Yu is a family nurse practitioner practicing out in Indiana, and she's the founder and owner of UDirect Health. And here she specializes in integrative and functional medicine, hormone optimization, aesthetics, and longevity. She is double board certified and she is very passionate about helping patients uncover root causes of their health concerns through a personalized, evidence-based approach to wellness. In addition to her clinical practice, she's also a national speaker and educator, and she's the founder of the YDH Training Academy. And here she trains healthcare providers in functional medicine, hormone optimization, gut health, peptide therapy, and aesthetic medicine. She also hosts a Better You Project, which is a podcast that is dedicated to helping people take a proactive approach to living healthier and more vibrant lives. And more importantly for me, Lexi is somebody that I look up to. She is a mentor. When I first brought on functional medicine to my practice a couple years ago, I wanted to do it right. I didn't want to just bring in weight loss or basic hormone therapy just to make a new revenue stream without really knowing what I was doing. So she was somebody who I had heard speak a couple times and she really knew what she was talking about. And so I myself joined her academy, and it has been incredibly invaluable and one of the best training money that I have ever spent. And I just really look up to her, and I really agree with the way she practices, and I see a lot of myself in her. And so I'm really excited that she wanted to host me on her podcast, and I'm excited to now bring this episode to you so that you all can enjoy it as well. And let's just jump right in. Thank you. Thank you so much for having me.
Yes. So what made you decide to get into aesthetics, and then what made you decide to get more on the integrative wellness side?
Yeah, so I started my career as an esthetician. I was actually a college dropout and pursued that. I started working for a plastic surgeon in Wisconsin. Shout out to Dr. Parfit. I love him.
Yeah.
And I really discovered this world of aesthetics, and I was really intrigued by it, and I wanted to go further. And my husband at the time, we wanted to live out in California. And so I went back to school to get my PA license, and I went straight into aesthetics after that. And I kind of had this dream of always opening my own huge conglomerate practice. Remember that show Grey's Anatomy, and they had that spin-off private practice, and they had all the different types of physicians? Yeah, that was like my inspiration. And so I always knew I wanted to bring in wellness, but I wanted to focus on what I knew first. So about a year and a half into my aesthetics practice, I started researching and learning and doing everything I could. I joined, your academy, and really took a year just to build out functional medicine. Because when I do something, I want to do the whole thing and I want to do it right.
Right.
And so then we launched that back in January. And that's kind of where the sexual wellness stuff kind of started. Throughout this research, I found so many women struggle with this, myself included. And it was always, well, how come some women don't struggle? Like, what's their secret sauce? I want to know.
Right.
And
right.
there's so many options for men and not a lot of options for women. So I wanted to really go beyond just providing O shots and screen creams and really practice what I always do, root cause medicine, and really find solutions for these people.
Yeah, I think that is very important, and I think it's underserved in the wellness community. I agree with you. And we've connected at so many conferences about this and about that, but I think this is such a much needed topic, like so many topics in women's health, because I think to this topic, it's a very sensitive topic. Sometimes women feel either shame with it, or the women, is there something wrong with me? And I always say to women too, just because it's common doesn't mean it's normal. So exactly. I think today what we're going to do is really kind of peel back some of the layers of beyond just the basic stuff, right? And I hope listeners, especially females listeners, are listening to that to know that you're not alone. There are practitioners that can help you. But I will say it's a very personalized approach, because as you and I have discussed, over the course of you being in our mentorship, it's beyond testosterone sometimes. Like, we have women whose testosterone can be sky high and their libido is still crap. And so looking back more into the mental health piece of it, the neurotransmitter piece of it, and really kind of the whole clinical picture beyond just, let's just give her more testosterone, because that is not the answer. So let's jump into some of these questions. And so what would you say, Heather, in your experience, what is like the biggest misconception when it comes to sexual wellness for both men and women?
I honestly think it's the same for both sexes. I think it's that as you get older, your sex life is going to die. It's going to be non-existent. Or, once you get married, 2-3 years in, everything's going to die off. We have these cliches and these jokes that we make in society of the tired wife with no libido. And then, the midlife guy going through a crisis and you can't get an erection. And we make jokes about this. And, I think we train society to think this is normal. This is what's going to happen in life. Just deal with it. But, it's not. There are treatment options. There are ways to address this. And this doesn't have to be the case. You can be having a great sex life, like into old age. And we shouldn't think that that's gross or cringy. We should celebrate that.
Yes. No, absolutely. Absolutely. So I guess the question is we've mentioned the word sexual wellness, like, what is that, exactly? So I always like when I bring on, someone who's really specialized in an area, who has really take the time, which you have, to really study it. Can you define what is sexual wellness from like a clinical perspective?
Sure. It's very, very complex. I did not realize how complex this can really be when I first started researching this and diving into this. So how I have kind of gone about it in my practice to simplify it is I break it into kind of a process, like a 4-part process. So we have desire, we have arousal or sensation, and then we have pleasure, and then we have orgasm. And I feel like once somebody is optimized in each one of these 4 categories, that's when we truly reach full sexual wellness. And it's also important that if you are meeting these 4 milestones, that you're also doing this without needing to talk yourself into it, without having to roll your eyes and, okay, let's get this over with, without having disconnect from your partner and, having it be a chore, without it being painful. We want this to feel good and we want this to be enjoyable, and without having anxiety around it. Oh my gosh, am I going to finish? Am I going to do something wrong? Oh my gosh, when are we going to have to do it again? So to be able to go through that whole cascade without any of those external factors. And this can really look different for women and men. With women, we really are focusing more on the desire aspect, and a lot more on arousal. So a lot of lubrication issues and making sure that sex is feeling good. And then whereas on the men's side, typically desire is not as big of a factor, but it still plays a role. But we're more focusing a lot on not only getting an erection, but maintaining an erection, which I think is a forgotten piece. And then stamina and recovery for them, and them being able to be present and not being, having to think of other things to get the job done. So
Absolutely.
When we kind of support all of those, I think then you're in perfect sexual wellness.
Yeah. Yeah. So what I'm hearing you say is that it's multifaceted. It's not just take this little blue pill, or just, do this testosterone, or just sniff this PT-141. It is multi-layer faceted, which is probably why traditional medicine doesn't do a good job, because it doesn't fit in this little perfect if-then statement, which is unfortunate. So let's talk a little bit about, how do you assess the sexual concerns, whether it's either a physical assessment or like a psychological, or is there like a questionnaire, or do you have like a certain tool that you're like, I have found this to be very helpful? So break that down for listeners.
Well, about 75% of where you're going to get a lot of this information is going to be your medical history, and then your kind of questions that you're asking them. Because a lot of the sexual response cycle is going to be subjective, and it's going to be them telling you what's going on. And so again, I take those kind of 4 milestones, and I kind of use that as a guide of, where are we having the stops? Where is the difficulty occurring? So if it's a low desire, that's kind of like, we've already stopped. We haven't even begun, and we're not even into it. So the no desire is going to be more of a psychological aspect, as well as a nervous system. So a few neurotransmitters are going to play a role here. So a lot of times we see people with chronic stress, burnout, they have trauma issues, there's interrelational issues, things like that are playing a role in that psychological side. And then on the nervous system side, dopamine depletion is a huge, huge culprit of not being able to have that desire to want to have sex. Then we can see we have patients who have desire, but the parts aren't working. So they're not getting aroused, things aren't getting lubricated, they're not feeling any sensation. So this is going to be more of a physiological issue going on. And that doesn't mean that there's not psychological kind of underlying with that, but we're focusing a little bit more on hormone balance. We're looking at blood flow, vascular issues, their tissue integrity. Is everything, nice and healthy? We're looking at other, not only the sex hormones, but we're looking at their thyroid, their cortisol patterns. And then we take a look at medications. So a lot of people don't know or realize that if you go to your normal doctor and you're complaining of a lot of these like no desire issues, you're given an SSRI a lot of times, because they're like, oh, you're depressed. SSRIs will kill your libido. So we also look at that, and if it's absolutely necessary for them to be on that SSRI. And then the third category is, I think what most people or most women struggle with is the desire's there, the parts are working, but they can't climax. They can't reach orgasm, or it's an immense chore and they have to really, really concentrate. And so this is really a lot of your nervous system being in a hypervigilant state, or your pelvic floor just being overactive. And so what we're trying to do here is we're trying to get you out of your sympathetic nervous system state where you're in your fight or flight, and we're trying to calm everything down and get you more into a parasympathetic state. Oxytocin is a big one here. There's a lot of other supplements and herbs that can help with this, and therapies. But this one I would say is probably one of the most common. If you are in fight or flight, you physically cannot have an orgasm. So it's really important to get them out of that. And then one of my most important tools that I use is I ask 2 very important questions when they come in and they start complaining about this. The first is, do you masturbate? And the second is, do you orgasm when you masturbate? And this is very important because this helps distinguish if there is truly an issue going on, or if it's more a psychological or interrelational issue. So if they masturbate, they obviously have a desire. And so this is where I'm looking more into what's going on in your relationship. Where are those roadblocks? Are you not feeling safe? Because obviously you do have a desire. And then if you can orgasm alone easily, but you're just having trouble when you're in the bedroom with somebody else, then again, we're layering on not just that physiological, but there is going to be more of that psychological component to it. And so that way we can address every facet of it.
Yeah, that's a very important question. And a lot of times when I'm doing an intake on a patient, or we're doing a consult for whatever it is, an O shot, Addy, whatever, I do ask that because sometimes women are maybe too shy to tell their partner what feels good to them.
Yeah.
And I think that like normalizing that conversation, I think can really help. Just some of those basic barriers is like, I don't like it. I don't like that position. I would actually prefer it this way, and I think sometimes women, they just don't want to say it. They just don't want to say it.
They're afraid they're going to kill the mood. They're afraid they're going to hurt their feelings.
Yes.
They're afraid they're being too bossy. Like, oh, you're bossy all day. Now you're bossy in the bedroom. I think so. Yes. It becomes that psychological component that they just get in their head and they're anxious about everything.
Yes, no, I completely agree. So we've talked a little bit about kind of your domains, right? So is there anything that you would see on maybe blood work that would give you any kind of indication? Like, talk us through what maybe just like, so we talked about like the objective or the subjective. Yeah. Let's talk about the objective type stuff.
Yeah. So after all of that intake and we're kind of talking through everything, I do like to run like a full blood panel. Most importantly, I really like to look at hormones, sex hormones, as well as, like I said, thyroid hormones. Sometimes we look at cortisol because all of this plays a huge role in sexual wellness. So I never really look at, sexual dysfunction as a problem itself. Sexual dysfunction is usually a symptom of a lot of other things going on, and it can be a little bit of a clinical warning of other things to come. Men who suffer from erectile dysfunction, typically that can be a warning sign that within 3 to 5 years, we can start seeing cardiovascular disease or problems. Bless you.
Mm-hmm. Thank you.
So a lot of this I feel like it's more of a symptom. So if we can look at their hormones, make sure we have their hormones in balance. We also look at their metabolic panels. So we're looking at that metabolic function. That includes like their vascular health, again, like their insulin levels, their glucose levels. We look at a high sensitivity C-reactive protein, just in general. Are they having inflammation going on in the body? And then we look at even something like a B12, like is their energy depleted? Like is that a roadblock where they just don't even have energy for any of this? So looking at that full blood work can help us to optimize other systems in the body, which then indirectly will help with a lot of the symptoms that we're seeing with sexual dysfunction. The pelvic floor, I do feel like a lot of women probably do struggle with a little bit of that overactivity. They're just tense, and men can actually struggle with this as well. And it's very hard to evaluate clinically. The questions are very subjective. So if I do feel like that this is a problem or a bit of a component, sometimes I'll just like refer out for that. I don't really deal with it in my clinic and get them to, physical therapy if they need it. But mostly it's going to be that medical history and intake, and then my full lab panel. That's going to kind of guide where we're going to go with treatment options.
Perfect. One thing, so Alan, who's our, men's health nurse practitioner here in the office, one thing that he often will look at is like the lower legs of his male patients. And if it's missing hair in the lower, like where the shins are and things like that, he says that blood flow, vascular, it's probably not going because it's not getting the oxygen that it needs. And so the hair falls out. If it's not going to the lower extremities, it's probably not getting to the penis to achieve, full engorgement, full erection, and not only that, to hold it. So, I think sometimes too with older men in particular, we're doing an assessment on them. And I don't know if it's because we're female, but sometimes like, no, I don't have a problem. And I'm like, sir, your testosterone's 300. You don't have any leg hair. I would be shocked if you don't have a problem. So, having those conversations, and again, normalizing it for sometimes when you're of the opposite gender to look at all the other symptoms with that, which I think is absolutely important. So we talked about the assessment. We've talked about blood work. We've talked about the robust panel. We've talked about the domains. Can we get into maybe some of the treatment options? Like kind of what is your initial step? And then, or do you layer things kind of simultaneously, or do you start with one and then add in? So kind of walk us through what a treatment plan would look like.
So again, I take that kind of that roadmap of those 4 sectors we look at: the desire, the arousal, the pleasure, the orgasm. I figure out where we're sitting within there. I ask more targeted questions. And then I also use like a 4-step framework for deciding my treatment, or kind of put things into buckets or categories of the type of treatment we're going to need. So first and foremost, I get the emotional out of the way. If there is any psychological aspect, either having a conversation with them about it, or just giving them a space to talk about it, or referring to some type of proper therapy if needed. For the physical aspect, so if we're having an actual problem with getting aroused, getting the tissues lubricated, getting sensation in the area, I'm looking a lot at like local tissue support. So we're looking at things like estrogen creams, DHEA creams. This is where we're looking at some of the regenerative therapies that I think we're going to talk about a little bit later, like our O shot, or things like that. And then even, we don't have one at our practice, but, like a laser or a radio frequency microneedling device. Yeah. I know that you guys have one, correct?
Yeah, we have a Mona Lisa.
Yeah, Mona Lisa, yep. So I'm looking at therapies that are going to kind of support that tissue. So then I look into the neurological bucket. So this is going to be kind of our neurotransmitters. So here we're focusing mainly on increasing dopamine and or increasing oxytocin. So increasing dopamine, there's not just like a pill you can take, like here's some dopamine, take it. So we have to be creative in looking at different pathways that increase dopamine. So number 1, testosterone. I would marry testosterone if I could. I love testosterone. I love what it can do for so many facets of the body. But testosterone directly can help increase dopamine sensitivity. So it's a great one that we use. If your testosterone's in the tanks, your dopamine is probably going to be in the tanks. PT141, this is a really great peptide that we use for increasing dopamine. So we use this for people who have desire issues. If you're prescribing this for somebody who is just having like arousal issues, this is not going to help them. This strictly deals with that desire pathway. We optimize the thyroid. Again, so this is why those labs are important. We can ask them to do environmental or lifestyle changes, get sunlight in the morning, make sure you're getting enough protein. And your favorite, Lexi, make sure they're getting some damn sleep.
Yes.
It's one of the most important things. I think people really take sleep for granted, and they don't realize how much that can disrupt all of your systems. So make sure they're getting some sleep. We can also reduce dopamine blockers. So again, SSRIs that we already talked about, and then chronic stress. So this is where that cortisol curve comes in that we sometimes take a look at, because that will kill your dopamine as well. If we're looking more at kind of that oxytocin pathway, so oxytocin is going to be more for that. It's your love hormone. It's your connection hormone. And we're not talking about like, oh, let's stare into each other's eyes romantically and have this moment, kind of that ick. Like, it really is just making you connected to the event, connected to your partner, and relax you a little bit. So that's your emotional safety, your bonding. Oxytocin is really easy. We can take this in multiple ways. There's sprays, there's troches, little like dissolvable tablets you can put in your mouth. And then again, testosterone. Testosterone increases dopamine. Dopamine increases oxytocin release. So can you start to see how this is all very, very intertwined?
Yeah.
So I start to look at, some of that stuff. And then finally, I look at the hormonal pathway. And this is why I test for hormones. Hormones play a huge role in sexual function. Again, testosterone is huge. Testosterone hits on like 3 out of 4 of those actually all 4 of those pathways. So testosterone will help increase your desire. It's going to help increase arousal, mostly by increasing sensation, and it can increase your orgasm intensity. So we're hitting like 3 of those pathways, which, that's, great right in and of itself. Estrogen, we look at, we can use that for more local tissue support. So that's going to be helping keep the area lubricated. And then we look at DHEA, because DHEA in like an oral form is just like a precursor for testosterone and estrogen. So that can help just have more of it. But we also use it locally in the vaginal tissue as well for increased sensation and again, converting so that we can get more testosterone and estrogen in the area. Progesterone, I think, is still important in an indirect way. Like progesterone is not going to like fix your sexual wellness or your sexual function, but progesterone in general helps bring down your anxiety. It helps calm you. It helps put you in a little bit more of that parasympathetic state. So indirectly having this can really help with that, kind of orgasm difficulty type area. So I kind of look at all of those and then I build a plan for them by combining different of these modalities into one treatment plan. And sometimes we're starting with one thing and then we're moving on to another thing, or we're doing it in a stepwise fashion. It's not cookie cutter. It's different for every person.
Yep. One thing can you talk a little bit about, because I know you know the answer of this. So you had mentioned DHEA intravaginally. In our practice, we mix estriol with DHEA and we get it compounded because I love that blend. Can you talk a little bit about the benefits of DHEA? So as women get older and they do atrophy, which means kind of thin out in that area, can you talk a little bit about maybe some of the urinary benefits that women would get from like we talked about, I know we're talking about sexual wellness, but what about like some of the urinary benefits that they may get from it?
Yeah. So as we age, it's not just like a, postpartum issue. It's also just as you age, you start to lose bladder control. So everything inside that kind of holds that bladder up, holds that sphincter tight, that all starts to go and that starts to relax out. You get those, that cliche thing of, oh, you sneeze and like, oh, I just peed a little bit, or like, don't make me laugh too hard. I'm going to pee. So estrogen alone, as well as DHEA, both of those being used really help to thicken the tissue in the area. They help to hydrate the area. We get a lot of atrophy down in that area. So helping to kind of re-support building that collagen and elastin in that area really helps to keep everything kind of tight and positioned where it should be to help relieve some of those symptoms. So it's really great because you're not only getting those sexual benefits, but you're also getting you're removing this really huge embarrassing barrier of these like leakages that can sometimes happen. So it's kind of the best of both worlds.
Yeah, no, that's perfect. So we've talked about women's sexual wellness. Do many of those medications, can those transfer over into the men's health?
Yeah. A big piece for men is definitely testosterone. One thing I always like to talk about with men is it's not all about the erection, and it's not just like, oh, here's some Viagra, you're good to go. So, a lot of people ask, first of all, what's the difference between Viagra and tadalafil? They both help with blood flow to the penis area, but it's not going to get you aroused. It's not going to give you desire. If you're still not in the mood or you're having issues there, this is not going to be your cure. And just because you bring blood flow to the area, if your testosterone is still in the tanks, you're probably still not going to maintain that erection very well. And you're probably going to have a lot of trouble climaxing or performing well. So this is not, that's just the tip of the iceberg. We do use it a lot in men, but we use a lot of these other things that we're using in women as well. We do a lot of the neurotransmitter work. We don't, obviously aren't using like estrogen creams in them or anything like that. But the PT141 works great for them. The dopamine support, and then definitely oxytocin is a big one. And what I find for a lot of men too is, even if they feel like they don't necessarily need some of these things, like let's say they do feel like the desire is there, these can enhance it still. So it can bring a little spice to their relationship. So it really can serve as both methods. But I do feel like men are a bit simpler, but a lot of this stuff still can apply to them.
Absolutely. Plus, too, I've seen with men, in some of so we offer acoustic wave therapy in our office. Mm-hmm. I don't like using the word shock wave because no man wants to hear the word shock. Yeah. But like, I think to a degree at first, it's almost like oversimplified, but there are some things for males in particular. To give you an example. So we do O shot, or we do P shots, and we do the acoustic wave, but there are some nuances. And so when someone comes in for an acoustic wave treatment, so it's essentially we're emitting a little sound wave on the shaft of the penis to break up any kind of micro plaques that might be impeding the blood flow. So why tadalafil or Viagra is important? Those are PDE5 inhibitors. And so what those can do is they can help improve nitric oxide, which is a vasodilator, which improves blood flow to the area. But just as Heather said, if it's a neurotransmitter mindset issue, that's only going to carry you so far. In some of our men, we find that when they come in for their treatment, pre-treating them with a little bit of tadalafil before their treatment, because if they can achieve an erection during the treatment, we're able to actually get more benefit from the acoustic, because we're able to get into the different spots where blood flow might be being impeded. The other thing that we do, and I don't know if you do this with any of your patients, is I give them homework. And what I mean by that is we carry penis pumps in our office. One day Min was in the back supply and he's like, "What is this?" It looked like a little water jug. And I was like, "Oh, that's for our men's sexual wellness program." And the reason why is it's a muscle, right? You don't use it, you lose it. And so I have them at home. I need you to practice with this penis pump for 10 minutes twice a day, if possible, would be great, until the next time I see you, because I'm trying to improve the vascular area. A lot of times for men, I always say a lot of times it can be the plumbing, and women, it's the electrical. I've used that analogy so many times, but there are some things outside of the office that men can also do to kind of help themselves along, in addition to things like oxytocin and PT141. Heather, do you do much trimix with your male patients? Like any trimix injections, anything like that, where it's like the papaverine and elaprostadil, like the vasodilators and the relaxants?
No,
and into that.
We don't really treat a whole lot of, we don't focus a lot on men. It's really not our specialty at this point.
Okay.
We help them with some of the things that we can do for women, but even though we can do them, we don't do P shots in our office. Right now, we just don't want to deal with anything that can come with, weird patients, or I don't know if it's just the area we're in, but I feel like we get a lot of that where we are. But so we don't do a lot of P shot stuff. We don't, do any of the shockwave therapy. We really focus on kind of the basics part of it. If we feel like they need more, we do generally tend to refer to somebody who we know deals with that. It is something that we're growing toward, because we are seeing like a big part of the population that we're missing and we're underserving. But right now, I think, just again, because we're women, it's our personal experience as well. We really want to focus on women where they're kind of losing out. But it's definitely the future for us.
For sure. For like things like O shots, are you guys offering that in your practice currently? Yes.
Yes, we are.
And so I'd love to hear your opinion, just having that aesthetic background. What do you do for women who are, let's say, in their late 50s, right? And maybe their health is not as good. Like, I always tell patients, listen, your PRP is only going to be as good as what your health is, right? So it's like putting shitty gas in a Ferrari and hoping it runs well. So are there any things that you do to really try to help optimize those patients before they get an O shot? I'd love to hear what that looks like.
Yeah. So, I mean, we do things beforehand, but we also do things during. So we don't use a lot of PRP or PRF in our practice anymore. So I'll go over that. And then there are things we kind of combine with it for when they go home. So before they come in the office, this is kind of what we talked about earlier. I'm making sure all the other systems are optimized. I'm making sure their hormones are optimized. I'm making sure that, everything that we're seeing like on their lab panel is in place. Because that is going to give them a better treatment. If someone just comes into the office right off the street and they want an O shot, they're going to get a benefit from it, but they're going to get a much more sustained, long-term, stronger result if all those other ducks are in a row first. So we kind of try to address that first and foremost. Once they're in the office, like I said, aesthetic-wise, as well as for our O shots, we don't use any PRP in our office. But PRF is really kind of on the out, because with your PRF, you only have about 30 growth factors in it, and about 10 of them are active, and it's very pro-inflammatory. So it's a very weak product, actually. And like you said, as you age or if you have any blood conditions, this can affect the quality of your PRF. So we use a lot more advanced biologics, which to me it's not even the future of aesthetics and wellness. It is now. And it is quite amazing what we're seeing with it. So we use a couple different products. We use an exosome product. Typically, it's like an amniotic fluid type product. This has about 300 growth factors in it and about 350 billion exosomes per cc that we use, or per milliliter that we use. And all an exosome is a little vesicle that kind of travels around and tells other cells in your body to do certain things. So we use targeted exosomes that are going to talk to, skin cells and fibroblasts to increase collagen elasticity, skin thickness. We also use a stem cell product, typically Wharton's jelly. This has a few less growth factors, still about 200 growth factors, same amount of exosomes, but it has that addition of mesenchymal stem cells. It's really important that we denote that it's a mesenchymal stem cell. And what these stem cells do, I don't use them as much in aesthetics. I use them a lot in wellness, so like for hair or for building something that's not there. So it is beautiful when used in an O shot, because with an O shot, what are we trying to do? We're trying to increase nerve endings. We're trying to increase blood flow. And this is exactly what stem cells can do. They can create this, what's not already there. So they help to increase those blood flow networks. So we get this immense result in the quality of the tissue and orgasm capacity with a product like the Wharton's jelly. Typically, we'll reach for the exosome product or the amniotic fluid if we're just strictly trying to make the area look pretty, like if we're trying to make the labia a little bit smoother, or if somebody is on a bit of a budget, because the stem cells are quite pricey. But we still offer the PRF. We just really highly educate our patients, and we don't really use it too often.
Oh, that's perfect. That's really, really good. Are you doing, you had mentioned making it look pretty. Are you doing things like wing lifts or vaginal puffing, depending on where you were trained? Are you doing that as well?
Yeah. So we do, we call it labial rejuvenation.
Okay.
We don't use filler. I think you use filler combined with PRF for yours, which a lot of practitioners do. We tend to use Easy Gel just because, with Easy Gel, it's just a lot more leeway. It's hard to get lumps or bumps. It's hard to overtreat. With filler, that can still happen. And so we like to start with that Easy Gel to get a little bit more of that stimulation. Sometimes we'll even mix it with some additional exosome product. And we use that to kind of beef up those outer labia. This is not an inner labia treatment. And that helps to bring volume back there, because I don't think a lot of women realize that as we age, that area atrophies and it can look pretty flat and kind of wrinkly. So this is a really nice kind of cosmetic treatment, but also in doing that, that also still helps with sensation. So again, we're killing two birds with one stone.
Yeah, no, that's perfect. That's perfect. Is there any kind of like aftercare stuff or topicals, or like what is your typical aftercare recommendations for patients after they've had, an O shot procedure with you?
We used to not really do much. It was just kind of like, don't do any heavy exercise or have sex for like a day or two. And really after that, like you're kind of good to go. But recently we've started adding in the CO2 V-lift. We actually learned about this at the Aesthetic Next conference. I had actually looked into it, a year or so prior, but I was kind of like, we're not there yet. We're not really doing all of that stuff yet, but it's a really great product. And I do find that if people stick with the program with just that product, like if they're too scared to get an O shot or they're afraid of needles, they have to do a lot of them, but they can see a lot of changes in the tissue, not necessarily like, for helping with arousal or anything like that, but for helping with the outer appearance of the vaginal area. They can get that with just this product. But after we do the O shot, this is what we like to kind of use in the office for them to go home with, and then for them to use over the next, month or so to kind of do that multimodal therapy. So this is just helping with healing, and it's helping even more with building that collagen and elastin in the area.
Yeah, that's perfect. What do you say as far as no intercourse afterward? I feel like this is always a question we get.
Yeah. Really, they can go home and have sex the same day.
Okay.
It is not going to affect anything. We as clinicians usually tend to be just like over safe because we don't want someone to go home and do that. Some type of problem occurs that's completely unrelated, and now they're like, oh, it's because of this. So we just generally tell people 24 hours, 48 if you really want to be safe, but it's really not necessary.
Yeah. So I have found that some of my women, they're like, everything is very sensitive just because there's volume in there. And so a lot of times they're just like, we're going to need a couple days to recover just to let the swelling go down, and everything is just like uber sensitive. Like like one of my patients, she sent me a portal message. She's like, it just feels like, I checked on her the next day and she says, just feels like I had a lot of sex the day before. Like everything was just uber swollen and sensitive. Kind of thing. So yeah, no, I think that's perfect. I think that's perfect. So kind of wrapping up here, if couples are struggling, what would you say is that first step?
I think the first step is just not to be afraid to bring it up to one of your healthcare practitioners. And if you're bringing it up to a practitioner who you feel like is dismissing you or is saying like, oh, this is normal, or they're giving you these kind of like Band-Aid treatments, find another practitioner, get a second opinion. Try to find someone who maybe specializes in this, and know that it's going to be a journey. So this is not just, again, like for a man going in, oh, I'm going to get some Viagra and I'm going to be cured. This is not like, oh, I'm going to go get an O shot and I'm going to orgasm up the wazoo. It is multifaceted. There are many, many layers. It's like an onion. And there may be a little bit of trial and error of testing things out and, testing doses. For example, we have something in our office. We get it compounded and we call them Libido pops. They're little troches and they have PT-141 and oxytocin in them. But they come in multiple strengths. So we have found that men generally tend to need a higher dose. Sometimes women do as well. And then we can also compound in some tadalafil in there, which we surprisingly, we do use in women a lot. For those women who just really, really struggle, everything else hasn't worked. Or again, they can get aroused, but halfway through they're like, okay, it's not working anymore, or they dry up, or so those are like one of our favorite kind of gateway things. But there are so many other things that need to be checked, and don't try to cut corners and skimp and, oh, well, I don't need to do a lab panel. Like I'm just here to like get my O shot. Really dive into it, because the more facets of the process that you hit, the more optimized you're going to be, and the better I think your sex life can be.
Yeah. So it's actually really interesting. So in our practice, we're a very medical based practice, and we also offer aesthetics. And we do have some patients who come to us just for aesthetics, like Botox, Sculptra, Dysport, those things. But in our practice, if you're doing a no shot, you have to be a medical patient. And the reason why I say that is because if your hormones are crap, this is not going to get you where, and I'm very much like, if I'm doing something to you, we better be getting results, because number one, it's expensive. Number two, it's uncomfortable. And number three, like, don't do anything that's not worth doing, kind of thing. And so, we patients who call and they're like, I want to do a no shot. It's like, okay, well, you got to establish as a medical patient, because Lexi needs to look at your hormones and she needs to evaluate, like, what other things are we going to do to really give you a more holistic approach? And I think that's so important, especially because we see a lot of aesthetic practices getting into wellness, which is awesome for the industry. However, just as you said, I feel like so many people echo that, Heather, and the academy is, I joined the academy because I feel like I want to do things the right way, so like defining what that looks like would be really like getting everything under the microscope and looking at like, okay, well, if we're doing a no shot, like if your inflammatory markers are high, like your PRP is going to be crap. Or if your, estrogen and testosterone are in the toilet, I could O-shot you all day, but that's not going to fix this.
Yeah.
And your relationship, if your relationship's garbage, like I can give you all the testosterone in the world, but that's not going to make you like your husband anymore, or take out the trash or do anything like that. So I think so much, if there's aesthetic practices that listen to this podcast, it's, you really need to think about what is involved in a program. It's more than just a no shot, or it's more than kind of what Heather said. It's multi-layered. It's more than just doing a thing. It's a program. And I think that is probably one of the most important pieces of this podcast that I want people to really understand. And I know you do so much with it, which is, I think you're the perfect person to have on this because it's multifactorial.
Yeah.
So,
yeah.
All right. Well, this has been awesome. I think listeners are really going to find value in just understanding the different modalities, and then practitioners who are maybe either starting out or maybe you already offer something. I'm hoping that they take away some tidbits of, I probably need to look into that oxytocin or this cream, or maybe I got to get some penis pumps in my practice. Mm-hmm. Heather, where can people, oh, sorry, go ahead.
I was just going to say, for practitioners, get a good relationship with a compound pharmacy near you, because a lot of these modalities you can combine into one troche or one cream, or so your patient isn't having to do like 5 different things to help with compliance. So really look into that because they can be combined a lot.
Perfect. All right. Where can people find you?
So we are in Newport Beach, California, the Retreat Wellness and Aesthetics. We have 2 Instagrams, one that's focused more on aesthetics and one more on our wellness practice. So they are both at the retreat and then aesthetics or wellness, depending on which one you'd like to go to. And then I also am going to be launching my own podcast in December. It's called Beyond the Bandage. And so it focuses on a lot of what you were just talking about with really getting down to root cause medicine, not just like, oh, here's some semaglutide, like, bye, see you later. Or, oh, here's some testosterone. Yay, we're going to see you beef up. It really is looking at like bringing the veil back and looking at that root cause, multimodality treatments to get like fully optimized, healthy patients. I'm super passionate about that.
I'm so excited for you. Yeah. I love watching all of our members just like go on and do some really cool shit, right? It's good.
Mm-hmm. Yes.
Okay. So let's see here. We've talked about where to find you. Are you speaking at any conferences next year? Do you know yet?
Yes. So I've spoken at Aesthetic Next the past 2 years. Last year, I actually talked all about we talked about a little bit here, regenerative medicine and advanced biologics. I'll be speaking there again this year. Haven't quite decided what my topic's going to be yet, but I'm kind of looping in on a couple of them. So that's usually in September every year. So you'll see me there, and who knows what else may come up.
Perfect. And Heather, are you taking new patients? You personally? Are you taking new patients?
Yes.
Okay.
Typically at my practice right now, I don't see wellness patients. We have a wellness provider who solely focuses on that because I see aesthetic patients. I run the business. I'm a single mom. So my hands are kind of tied with that. But I do see all of the peptide patients. And I help out a lot with the sexual wellness patients in specific.
Wonderful. All right. Well, thank you so much for being on the episode today. And I hope all the listeners and practitioners have found it to be as helpful as I did, because I thought it was great.
All right, guys, what'd you think? If you want any information on how to get a hold of Lexi, any of her socials, or if you are a provider yourself and you're interested in joining her academy, I will put all of her links, all of her information, how you can get a hold of her in the show notes below. And if you guys have any questions on my experience in the academy, go ahead and reach out. I would love to help you with that. That is all I have today. And until next time, I will see you on the next podcast episode of The Retreat Radio. Have a great day. The information shared on this podcast is for educational purposes only. It reflects clinical experience and opinion and is not intended to serve as a diagnosis, treatment plan, or medical advice. As always, please consult with a qualified healthcare provider before making any changes to your health, medications, or treatment plan. If you want to be a part of our community, make sure to follow us on Instagram at theretreat.wellness and theretreat.aesthetics. Thank you so much for spending part of your day with me today, and until next time.